All this is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. Thank you very much for joining. Today is a Saturday. Tomorrow I'm going to be off. Today I had a number of things that I thought it was interesting to share. One of those is some more studies, small studies, pilot studies, preprints about ivermectin's use. Another interesting news is about Abbott's rapid antigen test, which does not need a machine. And then there are COVID-19 or SARS-CoV-2 sniffing dogs that are deployed at Helsinki airport in Finland. And finally, there is a Icam protocol, which is used in ICU department in one of the Florida's hospital, very similar to Math Plus protocol. And also, I wanted to share with you Dr. Paul Marik's YouTube channel that he just started. So he requested me this morning to share it with the cool beans and to see if you can subscribe and like what he's doing. So let's start. Welcome, everyone. I'm going to start with the with Dr. Marik's YouTube channel. So the channel itself, the link is present in our in the description as well. Here is a video that he has. So it is the beginning. There was a time when I was in the beginning as well. He has yet 11 subscribers and 199 views. So please do me a favor, like, subscribe, and share to his channel and share his videos as well. So with this, let's start our discussion. These are the two preprint studies. So not final yet, not peer-reviewed yet, but these have very interesting outcomes that I think you would like. So starting with the first one. The first study here is a trial on ivermectin's role as a prophylactic drug. So what they've done is check out a couple of things. Number one, the dose here used is a little bit larger than usual therapeutic dose. And they have a rationale, and I'll show you their rationale for using that. So what I've done here is their protocol is to use 40 to 60 kilogram for the patients or persons, 40 to 60 kilogram, 15 milligram. Then 60 to 80 kilogram is 18, and greater than 80 kilogram is 24 milligram. I have put here that if this was therapeutic dose, what will be the dose? And what I did was, therapeutic dose for ivermectin is 150 to 200 microgram per kilogram body weight. So I used 200 milligram, the upper range, and for greater than 80, I used 200 kilogram as the weight. So these are the comparisons, not too bad, but anyways, the ivermectin dose is larger than therapeutic dose. The way they administered these was that they gave one dose on day 1 of starting the study, and then on day 3rd of starting the study. Now, what was the study itself? The study was that they had two groups of people who were in close contact of confirmed COVID-19 patients. So they were family members, household members who were in close contact. And look at this. The rationale was that in the literature, ivermectin has been found to be safe even at the dose of 600 microgram per kilogram body weight when given for 3 days. So based on that, they actually used a larger dose. Now back here, they took two groups of people who were in close contact with the patients. One group was 203 people, and the other group, control group, was 101 people. These 203 people received ivermectin according to the dose I showed above. Their inclusion criteria, that who were included, and by the way, this is an Egyptian study. This is from, I believe, let me show you the name. This is Zagazig University in Egypt. So this is a study from Egypt. So first inclusion criteria was that people have to be asymptomatic at the time of starting. They have to be in close contact with the patients, and they have to be, so exclusion was, who was excluded? Those people who may have already been treated for COVID-19 or whose high resolution chest CT scans showed that they had COVID-19. So what they tried to do with this was that they tried to pick up those people who they thought will not be COVID-19 positive. And there still is a chance that they might be positive, but that is what their attempt was with the study. The chance will be that, let's say, if I am taking care of a patient who is COVID-19 positive, I am taking care of them, I may have become exposed, I may not have developed symptoms yet, I may remain asymptomatic, or I may develop symptoms a few days later. Similarly, for the chest X-ray as well, I may not have signs in the chest X-ray today, it may take time, or it may never appear as well. So some gap there. But here is their interesting result. Result was that people who were on ivermectin, 15 out of 203 developed COVID-19. So that was 7.4%. So if somebody was taking ivermectin prophylaxis, then if 100 people were taking the prophylaxis, 7.3% will still develop COVID-19. On the other hand, if people were exposed to COVID-19 patient, they were not taking the prophylaxis, then 59, that is 58.4%, almost 60% will become positive. So that is a very interesting outcome. That is a very interesting outcome, 7% versus 60%. And that is the power of ivermectin. My own, from my management, my own observation has been that whenever I give ivermectin, whenever I administer ivermectin, patient has lesser side effects, if at all, let's say heart rate change or blood pressure change compared to hydroxychloroquine. And number two, patient actually recovers very fast. So that is an interesting thing with ivermectin. Here is one more pilot clinical trial. This is from Baghdad University. And here, University of Baghdad or Baghdad, whichever way you want to pronounce it. This is their paper. And I have their paper open here as well. So before I go to University of Baghdad, let me just show you. This is the paper by the Zagazig University, Egypt. So in their paper, what they have done is the following. They say, somewhere up here, look at this. Sorry, I am scrolling through this. So here is their objective. To study the effect of oral ivermectin as a prophylactic option. Individuals, this is how they chose them. Inclusion criteria: age more than 60 years, asymptomatic household contacts. Exclusion: people previously treated for COVID-19 or asymptomatic contacts who have HRCT. Suggestive of this intervention, this is their table that I just showed you. Rationale for their table was that in literature, individuals can receive 600 microgram per kilogram of ivermectin daily for 3 days without side effects. And then this was their follow-up protocol. And I think the only interesting thing that interested me more, there are many other things that are interesting here, was their table 2 that showed 15 contacts, which I just showed you. So that is one. Second, this is the University of Baghdad. And in this university, they did a small pilot study, very small. 16 people were on management, and I believe 71 were not. So tiny study. So here is what they did. They had patients. So let me show you here from my own visual. They made 2 groups of patients who were COVID-19 positive. 16 were given hydroxychloroquine plus azithromycin plus ivermectin. 71 in the other group only received hydroxychloroquine and azithromycin. All of them were in the range of, in the category of mild to moderate. They were not asymptomatic and they were not severe. Still, they were all hospitalized. So they were in the hospital. And again, moderate will be the folks who develop hypoxia, mild were who did not have hypoxia. The way they gave them ivermectin, or the regime, the treatment, the management, was ivermectin 200 milligram per kilogram body weight. So that is a normal therapeutic dose for ivermectin. Then, so BD for 5 days, so twice daily for 5 days. I use this protocol as well. Azithromycin 500 milligram first day, and then 250 milligram for next 5 days, once daily. Hydroxychloroquine 400 milligram twice the first day, that means 800 milligram, and then 200 milligram twice, that means 400 milligram daily for next 5 days. This is what they had given, and what they found was the following. And I'm going to ask you, cool beans, some of the interesting questions here. So the first thing is, they found that the group that had hydroxychloroquine, azithromycin, and ivermectin, 100% of the people recovered in that group. So that is these 16 people. On the other hand, the 71 who were on hydroxychloroquine and azithromycin, 2 of them died. So 97.2% recovered. And this is where my basic concern is. So on one end, their result is that if you add ivermectin to hydroxy and azithromycin, then it becomes even more effective. What I do not feel comfortable with this study is that hydroxychloroquine and azithromycin together, when given, if it shows a result of 3%, almost 3% deaths in mild to moderate, that is a very large number for hydroxy and azithromycin. I've not observed that. So was it that there is no zinc in there? Or was it that the study size is so small that this is a random chance that people died in this group? Because if you extrapolate this to say if people would get hydroxy and azithromycin and 3% would die, then that is as good as placebo. In placebo studies, if somebody is not getting anything, then they would, even if they're getting some milder kind of medicines, 3% of the people die. So here, that is the question I was going to ask you, that do you feel comfortable that this is the result with hydroxychloroquine and azithromycin, that 3% of the people died? And then if adding ivermectin, then none of them died. I think the sample size is very small, that is one. And number two, I believe p-values are not present. There are p-values that they have shown for other things, but not for the recovery. So yes, so there is a comment by France that Luffy is weighing in. Luffy always weighs in. I think that he wants to have my throne of having the discussions here. Now, one more thing I failed to mention here, I forgot. That was the Egyptian study has a p-value of 0.001, which is really strong. What that says is that this result that you are seeing, if it was going to happen by chance, by some random stroke of luck, that this result would appear, then the chance of this result to appear randomly will be 1 out of 1,000. So that is a pretty strong result, that it is going to be difficult to find that 1/1000th chance. The second thing is that they did find side effects in ivermectin study. And I want to make sure that we all understand this, because there are some folks who are my friends, but they continue to say that ivermectin is safe enough to have no side effects. So I think that is not a correct position. And let me show you the side effects they saw here. So if I go to the Egyptian universities, so back to the previous study, as regards to ivermectin side effects, They were reported in 5.4% of the contacts. These were diarrhea, nausea, fatigue, sleepiness, abdominal pain, heartburn, tingling and numbness, and lastly, burning sensation. Right? So this is so there are side effects to ivermectin, and ivermectin can cross blood-brain barrier as well, and it can cause brain damage too. So we should not say that ivermectin does not have side effects. So Arun, there is a comment from Arun that the people who died may have comorbidities. So the thing is this, they have them all here. And most of the people who were involved were mostly healthy individuals. So here, look at the participants. Inclusion criteria were the following: men and women with age at least 18 years, mild to moderate, diagnosed by positive PCR, testing lesser than 3 days, patient acceptance and willingness, hospital admission, and no participation in other trials, and able to provide informed consent. And then here are the symptoms they had: fever, cough, fatigue, and anorexia, shortness of breath, myalgias. Then exclusion criteria was that if they were severe case of COVID-19, where their oxygen saturation was dropping, or they were in ICU, or where their ALT and AST, the markers for severe cases were increased. Then they do have the data here that shows what kind of population, because it's a small population that they did the data on. So look at this. Baseline characteristics of IVM versus non-IVM. So IVM group 16 folks, male 11, females 5, severity mild 9. So IVM mild 9, moderate 7. Clinical features: cough, fever, myalgia, sore throat, underlying disease. So look at the comorbidities, as Arun had said. So 4 people had comorbidities in IVM, and that was diabetes mellitus, hypertension, and asthma. 29 people, so again, we are comparing 16 and 71 groups. 29 people had the comorbidities on the other group. I think this is the percentage, 40%. This had 25%. And that was diabetes mellitus, hypertension, and asthma. So there were comorbidities there. So my own observation, once again, I have now managed patients who had hypertension, who had even uncontrolled diabetes, cancers, hypertension very commonly, and they did not have an issue with hydroxy. But I usually add ivermectin as well nowadays. Okay, so hopefully these two are interesting. I'm going to continue. Next is, so tell me this, what do you think about these two studies? They are small, but they are interesting. Look, we have studies from, we have observations from Australia as well. Dr. Tom Borody says that he uses ivermectin with azithromycin and doxycycline, I believe. Ivermectin, he has triple therapy, which has ivermectin, azithromycin, and one more drug. And he has good results. Dr. Alam in Bangladesh, he has good results. I have good results. And then, of course, we can see that there are good results here as well. But I'm not comfortable with hydroxychloroquine and azithromycin results here. Okay, so then moving on to the next topic. And that is the Abbott. So Abbott has a test, they are calling it Binax now. So here is their site, and I have the link there. The test is $5, and test has this card, and in this card what you do is that you take a patient's nasal or saliva sample, and you put that on this card here, I believe, and that gives you within 15 minutes a result of positive or not, without the requirement of any machine. So this is a similar test like we saw with Dr. Herrera, where you take the sample and you put that in a tube, and within a few minutes it shows you the results. It's a similar thing, but for Abbott, they have gotten the FDA's approval. So that's a big company thing, right? They have the approval. The small companies are still struggling and figuring out how do I get approval. They have the approval from FDA and they have the test available. And the way it works is this. Check this out. Healthcare worker opens the card and lays it flat on a countertop. Extraction reagent is added to the test card, which is about the size of a credit card. So on the test card, you put the reagent or the chemical substance. Then you have a nasal swab and you put it on the test card. And then what happens is, once the test cards start changing color, they have an app that they called, the app name is Navica app. So Navica app would then read the results. Then it would send you the results on your phone based on whatever it's found and say yes or no, positive or not positive. The test is done within 15 minutes. The price is $5, and they are making millions of tests right now to be made available to point of care. I try to go buy some of these just to see what is their requirements to sell them. And of course, they're looking for the license for the lab, if you can run a lab or not. What I really protest and I do not like in the US is the capability or ability for us to be able to buy our own tests and test. We can buy glucometers, we can buy blood pressure apparatuses. Why can we not buy other tests as well? This is the time to allow us to do that. So on that note, remember I talked about Kivano app, that vitamin D test. So they reached out to me and they said, thank you very much for the video that you made. And we are not able to sell it in the US because we are still in the process of getting approved. I don't think they're going to get approved for home testing. Somehow US does not like people to do home testing. So they said, we can send it to you for demonstration purposes. So I think it is on its way. And hopefully when it comes, we'll do an unboxing and testing of vitamin D together. But I really protest that these are the kind of things that are necessary right now for us to have. They should allow them. So anyways, this still is a positive thing that we have now a test with a big company that can be produced in millions and sent out to point of cares. So see here, we will ship tens of millions of tests in September and will ramp manufacturing to 50 million tests a month in October. Abbott is manufacturing the test at massive scale in 2 new US facilities. So that is a good news generally. All right, so then next topic for today, and that is the cute dogs. So here, so there is a company in Finland. They have dogs that they had trained them for sniffing cancer. And now they have retrained some of them. I think they are training 11 dogs. 4 of them have already been trained and are now working at Helsinki airport. I saw their video as well. It is pretty cute, the way the dogs kind of tell that here is the test. So what they do is, when the passengers arrive, they have a little card that they kind of put on the skin and wipe some part of the skin's some of the skin's substances or sweat, and then they put that in a glass and put that in front of the dog. And I think dog has a sample or a control as well, which is known COVID-19 positive. And then dog would actually smell both of them and then say if the new sample has the COVID-19 or not. And this is done within 10 seconds by dog. And then the whole process takes about a minute. What I love about this one is that if you take all the passengers coming in and do RT-PCR on all of them, one, it is going to be costly. Secondly, it takes time. So here we have a less costly, cute way to kind of figure it out very quickly. So maybe there can be a chain of mechanisms. For example, first look at the temperature of somebody, and then based on that, separate out people. Then look at the, if somebody has fever, they're definitely going to be in quarantine. Then those who do not have fever, they can probably go towards the dog station, and there they look at the PCR. And then maybe there can be Abbott-like test as well. And some people go towards dogs and other go towards Abbott-like test. And from there, it continues to move on. So there is a e-dogs comment. Can dog also smell cash hidden in my smelly socks? So Debbie Boss, absolutely. So dogs for schools. So these can be actually used for schools, for large working complexes, for factories, for airports, for train stations. And I think that that is a very quick, rapid way of screening people. The accuracy, so this has been used, this method, the dogs, they have been used in France, I believe, Australia, Brazil, Saudi Arabia, and a few more countries. Now, of course, in Finland. And the reports are that the dogs are accurate anywhere from 95% to about 100%. So that is a very decent sensitivity and specificity. So I love this idea. I think that these should be in a lot of places. These should even be, they should be dog camps, cabins, where these guys are sitting, and you go in there and say, I'm curious if I'm positive or not. Can the dog quickly tell me? And then you just move on. So this was cute. I like this. And this is, the only thing is scalability of the dogs themselves, but this is a very good idea. It is fast. And finally, talking about the Icam protocol from Florida. So in Florida, in one of the hospitals there, they are using Icam protocol. And Icam, in medical terms, we normally say Icam is intracellular adhesion molecule, but it is not that. So I over here stands for immunosupportive things, and that is vitamin C and zinc. You would see that this protocol is very similar to Math Plus protocol. Vitamin C and zinc, I think vitamin D should be there as well. Then C for corticosteroids, and that is dexamethasone. You know that from Dr. Marik that he prefers methylprednisolone. So dexamethasone or methylprednisolone. Then A for anticoagulants, where again from Math Plus we know aspirin and enoxaparin or light molecular weight heparins. And then for M is the macrolides, that is azithromycin. So that is a protocol they have been using in Florida. One of our Twitter friends had actually said that one of my friends had the COVID-19 and they went to this hospital and they had used Icam protocol on them. So I think that this protocol can be augmented a little bit, but this is good enough as well. I would have loved to see hydroxy and ivermectin. I would have loved that American authorities just allow hydroxychloroquine and ivermectin for prophylaxis and for early treatment. I fail to understand their problem, that we have so many people dying and they are just not approving it. So here is the Florida doctor found a coronavirus cure. And so this is where Icam isn't a new drug. It's an acronym for a combination of existing things. I just talked about it. Here is their comment. We had no need for mechanical ventilation, and the patients all survived the discharge regardless of age and regardless of past medical history. That is what they said. Although this is not a study, this is a report by a doctor. They did not even tell the numbers. They simply said that, hey, this works. So these are the discussion points that I thought were interesting for today. My takeaway is once again the same. Early stage, prophylactic stage, vitamin D, vitamin C, zinc, quercetin. I wish ivermectin and hydroxychloroquine here as well. Then early stage, hydroxychloroquine, ivermectin, azithromycin, zinc, quercetin, NSE, CoQ10, and then vitamins. Then mild to moderate stages, add the anticoagulants, and then later on, of course, the other drugs. That I think is the simplest way. And interestingly, the earlier you catch and fix it, the cheapest it is to fix. And the later it becomes, the harder it becomes to manage and more expensive it becomes to manage. So that is the discussion for today. Tomorrow is my off, and I will continue on Monday. Somebody has made a comment about Dr. Barodi. I actually tried to reach out to him. I actually put in a request to say, can you come and join us? And they have not even responded. So if somebody knows them, can you please ask them if they can join us? So actually, Jonathan Loon says, can you please reach out to Professor Brody? I have already tried it. I have left the request in there. They have a process to put in the request for his media appearance. I have done it. They did not respond. So they have ivermectin, doxy, and zinc. So that is their triple therapy. So C Shang Q says that I know him and I'll ask. Thank you very much. Thank you very much. So really, guys, I think the cool beans here, I think we can manage this huge disaster that is continuing. Can be easily managed if we put people on prophylaxis, vitamin D, vitamin C, melatonin, zinc, quercetin, CoQ10, NAC, and then hydroxychloroquine and or ivermectin. And then we treat them early with the similar drugs, maybe add azithromycin or doxycycline, and then other things for symptoms. We ask people to do social distancing, wear masks. I think that is it. This thing can just go away. And we are just making a mess, at least in some countries. All right, guys. So thank you very much. Love you all. Please do me a favor, like, subscribe, and share. And if you wanted to support my work, the channel, the link for donation is in the description. So you can write to gp@cdd.com.au. I have already put in that request. Cool. So thank you very much. See you tomorrow. See you on Monday.